Radiation biology and lethal dose calculation. LD5030 understanding the lethal dose calculation. In radiation biology and medical physics, the concept of LD5030 is an important parameter to use to estimate the severity of acute radiation exposure to the whole body. It mainly used to evaluate radiation accident and understanding radiation sickness and guide for medical response. Definition of lethal dose 50-30 is the radiation dose is expected to cause death in 50% of exposed individuals within 13 days if no medical treatment is provided. The value provide biological indicators of radiation toxicity in humans. Then biological mechanism behind LD50. It's occur in 4 stages. First is energy transfer. The radiation interact with cell primarily through ionization process. Because human tissue contain more than 75% of water, most radiation energy is deposited in water molecules. Second is free radical generations. The interaction process free radicals such as hydrogen H2O and H2O2. The reactive space damage critical biomolecule includes DNA, proteins and chromosomes. And third stage is cellular failures. After that, as a result of cellular effect occurs, inhibition of cell division, chromosome abbreviation, gene mutation and cell death. When a large number of cells in vital organ are damaged, normal body function fail. Then we discuss dose accelerator radiation effect by level. Whole body irradiation produce several biological effects depend on the absorbed dose. As radiation dose increase, damage to vital tissues such as bone marrow, gastrointestinal tract and central nervous system become progressively more severe. In these slides, tell us the biological effect of acute exposure to radiation. In 5 to 10 gray, nearly 100% mortality or death occurs. In 3 to 5 gray, the LD50-30 range, the severity effect 50% mortality within 60 days or within a week. Greater than 1 gray, onset of radiation sickness, nausea, vomiting, diarrhea occurs. Greater than 0.5 gray, reduce the white blood cell count. Greater than 0.1 gray, chromosome absorption become detectable. and less than 0.1 gray, no detectable biological effect occurs. And we discuss about the 3 gray to 5 gray, which is LD50-30 range. The biological bottleneck is in 3 to 5 gray. The bone marrow formation or bone marrow tissues, spleen and lymph nodes are targeted, which occurs district reduction in vital lymph and granulocytes in the blood, and the clinical result is severe anemia, uncontrolled infections and higher fever, which occurs immune and blood forming system completely fail. This specific physiological collapse is the biological basis of LD50-30 staminations. Then after 3 to 5 gray, which is Hematopoietic syndromes, we discuss Gastrointestinal Syndromes, which is occurs in 7 to 10 grays. Interstitial lining cell target and symptoms are severe diarrhea, dehydration, electrolyte imbalance and weight loss, and death within 7 to 14 days. Then central nervous system syndromes or central nervous system damage within 25 gray or greater than 25 gray, which is damage the brain or central nervous system. Symptoms are delirium, coma, depression, severe fatigue. Outcome death within hour or 2 days. Then we discuss the local somatic effect of radiation exposure to specific organ are 0.15 gray to testis, which is occurs temporary sterilization, and 3.5 to 6 gray to testis is permanent sterilization. 1.5 to 2 gray to ovary temporary sterilization. 2.5 to 6 gray ovaries permanent sterilization. And in hair follicle 3 gray temporary hair loss. 5 gray eye cataract after 5 to 10 years. 6 gray skin erythema duplication. 10 to 20 gray skin bones blaster necrosis. In earlier somatic effect, appears within few hours to week after radiation exposure, especially after high or acute dose, which is already discussed. Hematopoietic symptom effect, which is occurs 1 to 3 gray. Radiation damage blood formation organs such as bone marrow, spleen, and lymph node. Typically, findings include reduction in lymphocyte and granulocyte count, nausea, vomiting, weakness, and fatigue. When dose exceeds 3 gray, severe damage to blood forming system occurs. In the range of 3 to 5 gray, about 50% of exposed person may be die within about 60 days of untreated. Mainly symptoms include anemia, infection, and high fever. The condition is known as Haematopoietic Syndromes. Then we already discussed Gastrointestinal Syndromes, which occurs within 7 to 10 gray. At higher radiation dose, gastrointestinal tract cellular severity damage. Symptoms include severe diarrhea, loss of appetite, dehydration, electrolyte imbalance, and weight loss, and high fever. Death usually occurs to 7 to 14 days. Then central nervous system, which is occurs within 25 gray or greater than 25 gray. Extremely high radiation dose affect the central nervous system. Symptoms include depreciation, severe fatigue, delirium, coma. Death occurs within a few hours to 2 days. Dose response, natural or earlier effect of somatic effect. Earlier somatic effects show a threshold dose, that means below a certain dose no effect. Above the threshold, severity increase with dose. Therefore, the effect is called as deterministic effect. Example includes skin erythema, hair loss, sterility, cataract, tissue necrosis. Then we discuss local somatic effect, which is include the radiation exposure to specific organ, which is already discussed in previous slides, which eye cataract formation more or equivalent to 5 gray, hair follicles damage in 3 gray, gonads male temporary sterilized 0.15 gray, permanent sterilized 3.5 to 6 gray, female gonads 1.22 gray, temporary sterilized 2.5 to 6 gray, permanent sterilized. Skin 6 gray, erythema duplication 10 to 20 gray, bone blaster and tissue necrosis. Then we discuss late somatic effect. Late effect appears month or year after radiation exposure, typically period of 30 to 40 years. They often occurs low dose receive over long time. Important late somatic effect includes cancer, fibrosis in tissue, cataract formation. Then we discuss hereditary effect and risk baseline. Hereditary effects occur in future generation of exposed person. This effect result from radiation damage to germ cells, sperm or ovum that participate in fertilization. If radiation indicates gene mutation, chromosomal absorption, it reproductive cell, this gene change can be transferred to offspring. Key characteristics of hereditary effect are occur in progenesis, not the exposed individual, result from damage to reproductive organ before occupation, caused by mutation in germ cell. Unlike deterministic effect, hereditary effect follow a probabilistic pattern. Stochastic nature of hereditary effect are belongs to the category of stochastic effect characteristic. No threshold dose, even small dose may carry some risks. The probability increase with dose, but severity does not depend on dose. According to radiation protection estimate, each survey per million people, cancer risk is 50% and hereditary disorder is 10. Then stochastic effect, non-stochastic effect occurs entirely by chance, usually associated with long-term low-level exposure, which is non-stochastic only after a specific biological threshold level exposed to exceed. Probability increase with dose, but severity depend of the dose. The severity of effect increase rapidly with dose. Then we discuss the difference between stochastic effect and non-stochastic effect or deterministic effect, which threshold is no in stochastic effect is no threshold exists. Define the threshold exists in non-stochastic effect. Dose relationship, probability increase with dose, severity is dose independent. In stochastic effect, severity increase directly with dose. Latency, long latency period, year or decade. But in non-stochastic effect, immediate or short latency, hours or week. Clinical example: cancer, genetic mutations, skin-borne radiation sickness, cataract. Then we discuss concept synthesis, the radiation impact workflow. First, radiation exposure, which is high dose or short term, low dose or long term, which occurs high dose exceeds threshold, in low dose no threshold or probability. In higher dose, non-stochastic or deterministic effect occur, and in low dose stochastic effect occurs. In non-stochastic effect, earlier somatic effect and acute radiation syndrome, which is LD5030, syndrome applies here, but its stochastic effect leads somatic or cancer or hereditary effect occurs. The operation application in medical physics of lethal dose 50-30 are it is a benchmark for target patient and accurate estimates of biological severity of acute whole body exposure. Setting strict dose limit in clinical environment and specific to migrate long-term stochastic risks cancer hereditary detectors. Emergency planning, understanding precise deterministic threshold to estimate emergency exposure limit, preventing acute radiation syndrome in both operation and patients.